Okay, so we'll start off because in the interest of time, we don't want to waste too much time setting up. We have collated this instruction course, and we are happy to say that it is now in its 7th year. It's an invited course. We are quite honored and privileged by this. And the structure of this course has evolved over the last so many years. And what started off as a very focused discussion on the FRCS examinations has now evolved into something that would be of interest to everybody in the fag end of their training in ophthalmology, and as they embark on this journey of ophthalmology, a sort of eye opener into what are the other possibilities. So I will introduce our speakers as they come. I am not Dr. Divina Venkatramani. I'm Dr. Devendra Venkatramani, and these are our esteemed faculty. But we will, start off in the interest of time. We have certain topics on international examinations. We have topics on resources for clinical training, and talks on also the what one can do after one's training in ophthalmology, not necessarily restricting oneself to ophthalmology or medicine. So without further ado, we'll start off the session on the FRCS examinations. So the Royal Colleges, as one may be aware, are principally 3 in number. These are scattered throughout the United Kingdom. In chronological order, they are the Royal College of Surgeons of Edinburgh, the Royal College of Physicians and Surgeons of Glasgow, and the latest, which is probably the most important in terms of practicing in the United Kingdom, is the Royal College of Ophthalmologists, which is headquartered in London. Now, my talk will be about the FRCS Glasgow, which is the most popular examination that is conducted across the world amongst all of these Royal College examinations. And it's a very old college, established in 1599, and these are a few images from Glasgow where we had gone after the examination was successfully completed for the convocation ceremony. नहीं, उधर डिस्प्ले नहीं हो रहा है ना? Okay. So these are a few of the pictures from Glasgow. So this presentation is incomplete without mentioning my study buddy, Dr. Asif Virani, and this would be the first tip for any aspirant of this examination, is to have somebody you can bounce off your preparation with. And the two of us, after successfully completing the examination, went and attended this beautiful ceremony, the convocation ceremony, with a lot of pomp and pageantry. So it's something you can treat yourself to after giving this arduous exam. In brief, the examination is divided into 3 parts. The first part essentially tests you on basic sciences, which is optics and refraction, as well as clinical ophthalmology. They're all MCQ examinations, MCQ tests. The second part is on clinical sciences, which are again an MCQ test. आप आगे बढ़ा रहे हैं? हाँ. And the third part, so the MCQ, so the second part used to have a problem-solving component, which was a written examination where you had essay kind of questions. That has since recently been discontinued, and now this is also in the form of an MCQ examination. The third part is the actual practical examination, as we may wish to call it. It is an OSCE component called a structured oral examination, which has 3 stations, and the clinical examination, in which you see patients and examine patients in front of the examiner. These are conducted on 2 different days, so you have a day's gap in between generally, and it becomes a 3-day event. Who's eligible to give these examinations? For part 1, you need a primary qualification that is acceptable to the GMC UK, which essentially means an MBBS degree from India is fine, but you need minimum 2 years post-qualification experience, to which your 1 year of internship counts. So you don't need any special ophthalmic training to appear for part 1. For part 2, however, you require 6 years of post-qualification training, which also once again includes your 1 year internship. And 4.5 years of these 6 years should be in clinical ophthalmology. So if you may have done a post, or if you may have clinical experience in a non-ophthalmic field, that can still count towards these 6 years. But 4.5 years, sorry, that's not months, that should be years. 4.5 years should be in clinical ophthalmology. So it is not so easy probably during your residency to give this. You may have to wait post-residency, post-fellowship to give part 2. And part 3 essentially requires you to have completed parts 1 and 2. These are the fees as of December, and they go up every year by almost 10%. So the sooner you start on this, this course, probably the cheaper it is, because there was, with Brexit, a little bit of devaluation of the pound, which made it a little easier. But as of 2 days ago, it's 104 rupees to a pound, so it becomes fairly expensive to give these examinations. Now you have 6 attempts for each part. These are data taken off from the website, so you can always go to the website and check these. But 6 attempts is really a long time, because by that stage, you know, for each part, 18 attempts, either you will be financially drained or physically and emotionally drained. So I'm sure nobody will require these many parts. It's not such a difficult examination as one may think. And now, recently, they have started offering the MRCS degree. So after completion of 2 parts, you may apply to them for the MRCS degree. And that, of course, requires a separate subscription fee that you need to pay for. These are certain exemptions. So if you've done part A, for example, of the Royal College of Surgeons of Edinburgh examination, or you've done the RCO examination, then you have cross exemption with the FRCS Glasgow examination. The rest of them are a little, and the ICO the ICO examinations also used to have some cross exemption with the FRCS Glasgow. The rest of them are national examinations. So unfortunately, neither the DNB examinations of India nor the MS examinations offer you any value as a cross exemption for the FRCS. This is the website, so I strongly recommend anybody who's taking this journey to first go through all these details on the website and make sure that you're familiar with all the rules and the exclusions before you set out. A little bit about the examination itself. These examinations are not as the ones that we are used to, where there is in India, there is generally a cutoff mark, whether it's 35% or 50%, which means you need to score 50% correct out of all the 100 questions, then you pass the examination. It's not like this over here. Here there is a pass mark that is based upon the difficulty level of the examination, which means that all the examiners or the paper setters will sit and they will set a paper which will comprise of some easy questions and some difficult questions. If there is a majority of difficult questions, the pass mark gets lowered. And if it's a majority of easy questions, the pass mark gets raised. So the pass mark is dynamic, and it depends on that exact paper. You won't know the pass mark before you appear for the examination. So here, for example, the pass mark was an extremely odd 62.21%. And if you score 62.21% or more, that's when you pass the exam. A little bit about how to prepare for the examinations. Part 1, which as I mentioned, is optics and basic sciences. I strongly recommend these textbooks, Elkington, as well as Dr. A.K. Khurana's excellent textbook on clinical optics. It can be a little large or voluminous to go through, but it gives you a good foundation, and I would therefore recommend passing or clearing part 1, both optics and clinical and the basic sciences, within the first year of your MS or DNB, because that's when you're freshest and you can really spend time and devote time to this. John Ferris, of course, this preeminent textbook of MCQs is excellent preparation both for the ICO examination part 1 as well as the part 1 FRCS. Part 2, which is clinical ophthalmology, again, being an MCQ based examination, I would strongly recommend this book, which is what I used, the Mass Eye and Ear Infirmary Review Manual, originally authored by Jeffrey Lampkin and subsequently by numerous other editors. And it has fairly difficult MCQs to answer, but they give you the explanation for each right and each wrong answer, so it's very helpful in that regard. There are questions on emergency medicine, so you need to be familiar with these emergency situations and their management. Once again, these are the sort of syllabus that is taken from the website of the FRCS exam, for FRCS, the RCS college itself. So you can see these, and you need to be familiar with not only the conditions, their diagnosis, but also their first aid management and their treatment, including dosages. So you would need to know all of this as well. A few tips in the theory examination also, they are very practical oriented questions. You're not going to be asked percentages of or incidence of a particular disease, but you would be, you may be given clinical scenarios even in the clinical, in the MCQ test, and you need to come to a diagnosis and come to a proper management. And in general, all your answers would proceed from a life-threatening condition to something that is then vision-threatening to something that would be only of cosmetic importance. So even when you're answering your Viva questions or your clinical examination questions, you need to be prioritizing your answer in this manner. Coming to the part 3, which really is the meat of the examination, as I mentioned, there's a OSCE station, which is called a structured oral examination, but it's really a whirlwind examination because you are put in front of 2 examiners and they show you different spots or slides, and there's very little time for you to really try to understand what they're trying to show you. But the good news is that the questions that they'll ask you are very structured. They won't ask you anything off the top of their hat. They would have questions that they are supposed to be asking you for that particular spot. So it's a very fair examination. It's a very structured examination. It's not arbitrary or based on the whims and fancies of the examiner, but it is exhaustive in the sense that you need to pay attention to certain topics that you would otherwise have ignored for your MS or DNB, including a lot of oculoplasty and neuro-ophthalmology. You cannot ignore these subjects because you need to independently pass these stations to clear the examination. So lids, oculoplasty and anterior segment are examined together. Posterior segment, including glaucoma, is examined together. And there's a separate station on neurology, motility and general medicine. Now, once again, in this station, most of the questions are ophthalmology oriented. So you may have questions on neovascular glaucoma or multiple sclerosis or rheumatoid arthritis, conditions which have ophthalmic importance. They won't ask you very esoteric neurological disorders, but you must know, have that breadth of knowledge to be able to answer it. So as I mentioned, it's in the form of a picture or a clinical situation. You may be given a report of a visual field examination or an OCT, and generally you will be asked more than one question per spot, so you need to answer each question correctly to go on to the next sub-part. The clinical stations are 4 in number. There's an anterior segment, posterior segment and glaucoma, neuro-ophthalmic and ocular motility disorders, and the last is oculoplasty and lid disorders. So you have only 12 minutes at each station. Once again, there's a team of 2 examiners at each station, and generally you have, you may be able to see 3 or 4 patients per station. The rule of thumb is that the more patients you see, the better you're doing, because it means that the examiner is satisfied with your answers and then asks you to examine the next patient. But don't be discouraged. You may spend a lot of time on one patient simply because the examiner is wanting to get to the depth of your knowledge in that. But once again, the questions are very structured and you won't be asked anything very extraordinary for that clinical topic. A very important point is that you have to practice these answers. It's not easy to jump from your DNB MS examination to the FRCS examination. I'm not calling it a jump in terms of it being a better or a more valuable examination, but it's simply that it's totally different. So you need to orient yourself in that manner. You need to practice fluency of speech, practice fluency of your presence of mind, thinking as to what exactly is being asked for, and focusing your answer in as short a time as possible to fit in and get in all the key words and the key points. A few advantages of doing the FRCS examination is that you don't need to then give the PLAB. If you wish to move to the UK, you can directly register with the GMC. Of course, I think most of us give these examinations for brand recognition or their brand value. There may be a potential for better remuneration in the Middle East, though of course the rules are changing, and now it is, in most cases, you require clinical experience in the UK before you can avail of higher paying jobs in the Middle East. Many of us just like to give examinations, which may be a reason, and you can add to your post-nominal initials. I am in the land of this esteemed gentleman. I don't suggest that we all take this route, but if this is your thing, then please go ahead. The sky is the limit, even in ophthalmology. However, there are disadvantages. It is not a licensing examination, unlike the FRC Opt, which Dr. Devesh will be talking to us about. And of course, it is an expensive examination, so I would strongly suggest you do financial planning as well before you embark on this. There's no point in clearing 2 parts and then finding that you're just too tired, exhausted, or busy to give the 3rd part. You would have just wasted, time, effort, and energy in that in that process. We've been on a break for this FRCS refresher course, but we plan to resume it very soon. This is conducted at Lakshmiya Institute in Panvel, where we have hands-on training for potential candidates for this examination with real patients. And I think these kind of courses would be useful because you need that practice of, of seeing patients and answering within that time frame to do the best during your actual exam. I wish all of the potential aspirants all the very best. We will take questions a little later because I think some questions may be answered in subsequent talks. So with that, I conclude my talk. And it is my great pleasure to invite our second speaker, Dr. Pranita Sahai. She is, once you get to her degrees, you will be suitably impressed. And she is very actively involved in teaching, especially postgraduate education. And she will be talking about ICO examinations, FAICO, subspecialty fellowship examinations, and really are they necessary and how do you proceed from there?
Hi, good morning, everybody. I'm Dr. Pranita Sahai. So I'll be discussing about FICO, FAICO, and FICO subspecialty exams. So once you crack your postgraduate entrance exams, you're all happy and elated, and you feel, wow, that's it. But once you start doing your post-graduation, within a couple of months or in a year, you realize that's not the end. You need to do something more that's going to add to your CV, because post-graduation is something that everybody is going through. So that is what you need to think and plan in advance, so that you give the right exam at the right time and don't waste your time, effort, and money, as Dr. Devendra was rightly telling about. So whether you want to study abroad, you want to practice in India, you want to go for a comprehensive ophthalmology practice, or you want to go for a subspecialty specific practice in ophthalmology, is what you need to decide, and on the basis of that, you choose the exam that you want to give. So if you want to go abroad and study abroad, there are certain fellowship certification courses that you can take up and clear these exams, so that your fellowships or certification courses or work outside becomes easy. So the various international bodies that conduct examinations are the International Council of Ophthalmology, the Royal College of Surgeons, which is Glasgow, Edinburgh, and Ireland, and the Royal College of Ophthalmologists, which is the FRC Opt examination. So first I'll be talking about the ICO exams. So the ICO conducts 2 types of exams. One is the ICO, which gives you an FICO degree, and the other is the FICO subspecialty exam. So the FICO itself has 3 steps. Okay, so the step 1 has 2 parts, which is part A, basic science, and part B is optics refraction. The step 2, which is clinical ophthalmology, and the step 3 is advanced examinations. Once you clear all these 3 steps, then you get your FICO degree. Subspecialty is something that we'll deal separately. So what do you deal with in your part A? Part A deals basically with your anatomy, physiology, and biochemistry. Okay. In addition to that, you also have to have a background knowledge of neuroanatomy, epidemiology and stats, path and micro, genetics and biochemistry. That means you need your basic MBBS knowledge in addition to your anatomy, physiology of ophthalmology. It's an MCQ-based exam. There's no negative marking, 120 standard MCQ questions. And the books that you need to read is, the book given by John Ferris is something which is very helpful to clear this part. So it basically helps you with all these various subsets that I talked about. And in addition to that, the AAO series and the Anatomy and Physiology book by Dr. Khurana is also very helpful. Now, part B deals with optics and refraction and instruments, which is again an MCQ based exam, unlike the FRC OFT, wherein for refraction you have a practical step. This is only an MCQ based exam. For this, again, Elkington, the Chua's Optics MCQs are helpful, Duke Elder, and Optics and Refraction book by Dr. Khurana can be read for it. For clinical ophthalmology step, you need a comprehensive knowledge, a holistic knowledge of the entire subject of ophthalmology. So you need to know all the specific subspecialties well, and in addition to it, general medicine related to ophthalmology, community and public health, and ophthalmic pathology and tumors is also something which you need to know in addition to your comprehensive ophthalmology. Again, it's an MCQ-based question paper with 115 questions, no negative marking. Kansky, American Academy of Ophthalmology, is the basic that you need to go through for clearing this step. In advanced examination, again, in addition to your holistic knowledge of ophthalmology, these questions in this step are not basically theoretical, but also check your clinical application to case-based scenarios. So you need to have a comprehensive knowledge again, like you're preparing for your MD Viva. So MD or MS Viva when you're giving your final exams. Once you're done with your MD or MS exam, that is the right time to write this advanced examination because you'll have a better knowledge by that time. In these, other than the MCQ, also have extended matching questions, and there's no negative marking in this step as well. Now, when to appear for these ICU exams? Now, since we discussed that the Part A and Part B are the basic sciences and optics, the beginning of your residency is the best time to start these exams because you have your additional MBBS knowledge fresh with you, and you don't need to put in a lot of effort to go back to the neuroanatomy and statistics and all that is part of this exam. Optics, the right time I would suggest would be by the end of your first year of post-graduation, because by that time you have started doing refractions, you know the basics of optics and refraction by that time. Clinical ophthalmology and advanced exams step right would be once you are done with your PG. I know a lot of you may be already in your second and third year, but it's never too late to start. You can still start writing the exams. For subspecialty, the eligibility criteria is separate. We'll discuss. Coming to the examination fees, if we look at a total of 3 steps, it costs a minimum of 1.5 lakh. So you need to plan well in advance and write the step only when you're well prepared because you don't want to go through an unnecessary financial loss. Now, there are certain additional benefits of appearing for these exams. Once you clear your part 1, that is step 1, which is your both part A and B, it gives you an exemption from FRCS Glasgow step 1. And once you have cleared the clinical ophthalmology part as well, it gives you an exemption from the FRCS Glasgow step 2 as well. So you can directly appear into your final step of FRCS Glasgow, which is your practical exams. Now, the other advantages, as we all know, we can use a post-nominal acronym with FICO added to your existing degrees. It also gives you opportunities for international short-term and long-term fellowships, which are advertised on the ICO websites from every 6 months. They are advertised. And you have 3 months or 2-year fellowships, which you can avail after applying through those websites. They also give scholarships and grants every year, and for which you become eligible once you clear the FICO exam. So that was all about the FICO exam. Now we'll move on to the subspecialty exam. So why is it necessary to give a subspecialty exam? We all know that in India, the MCH courses are very limited. We have only one institute running MCH course in retina and cornea only. So if you actually want to go into a subspecialty practice, you go for a fellowship. But fellowship does not give you an additional degree. When you clear your FICO or FAICO with a subspecialty degree, specialty course, it gives you an additional degree which you add on to your current affiliation. So nobody questions you, neither a senior, junior, or a patient is going to question you whether you're a cornea specialist or a retina specialist. You have that added to your affiliation. So that is why I feel it was important, and hence I wrote the ICO subspecialty exam. So it needs at least 1 year of experience in the chosen topic in which you want to appear. The various subjects in which ICO gives you a subspecialty exam is the cornea and external eye disease, glaucoma, retina, oculoplasty, neuro-ophthalmology, strabismus, uveitis, and cataract. As it is also an MCQ based question, so it is relatively easy to write this exam compared to FAICO, where you also have an additional practical step. This is only an MCQ based exam. Also, there is no negative marking. American Academy, Kansky, these are the basics that you need to read. But in addition to that, obviously you need to be aware of the recent advances in that specific subspecialty. Now, AIOS also thought about it, and they came up with the FAICO exam. In addition to the ICO, we have an indigenous exam, which gives you a certification to be a subspecialist. The eligibility criteria remains the same. You have to have a 1 year experience in the chosen topic. The subjects which it offers in addition to the ICO is refractive surgery and comprehensive ophthalmology, in addition to what FICO was offering. Again, this is an 80 question based MCQ with no negative marking. But the additional step, as I told, you have a practical examination which you need to clear. The passing rate for FAICO, unfortunately, is very poor, is just 30 to 40% every year. So you need to really prepare well, because the failure rate in practical exams is quite high. Okay. So basically, to decode the dilemma, if you're looking just at an international fellowship post your PG, you want to go for a 3-month or a 2-year course outside, ICO is the exam that you're looking forward, because it can give you scholarships and it can give you fellowships outside. But if you want to go for a specialty practice, say here in India itself, I would say go for FICO or FAICO subspecialty exam. However, if you want to plan to settle outside, FRCS Glasgow or FRC OFT is what is going to help you in future. So plan well in advance and take a note of the ideal time to appear, so that you don't have to duplicate your efforts and not waste your money and energy. So basically, I'd like to end this quote, and both me and my husband are going to end the quote on this note, is successful people never stop learning, keep learning and educating yourself. Thank you. So basically, the study buddy that Dr. Devendra was talking about is here, my co-instructor, Dr. Devish. We were study buddies to write all these exams together. Okay, thank you.
Thanks, Dr. Pranita. So, pick your study buddy wisely, almost as important as your spouse. I invite Dr. Pranita's better half, Dr. Devesh. Dr. Devesh Kumawat is similarly an excellent student, and he has appeared for all of these examinations. And he will be taking us through the FRC OFT examination.
Good morning, everyone. Thank you, sir, for the kind introduction. So I'll be sharing my experience on how I went ahead with the FRC of the examination, and when should you start preparing about this examination and how to excel. So you can visit this website. You can visit this website by the Royal College of Ophthalmologists, London, and majority of what I'll be talking about is already there on this website, and you can get all the details regarding the examination patterns, the examination schedules, and the resources that that are being mentioned by the college itself that you need to look at while preparing for these exams. So this exam constitutes 4 sub-examinations, and if you clear them, then you get the prestigious award of Fellow of Royal College of Ophthalmologists, London. And following that, you need to pay an admission fee, and then you become a member of the college, and then only you can use the post-nominal FRC OFT. And this examination is important. Unlike the other examination, this is the examination which is the exit exam for the ophthalmology trainees in United Kingdom. So this is a examination that every ophthalmology trainee has to give. It is like our postgraduate professional examination, and therefore this examination is a little different from the other FRCS and FICO examinations. Now, part 1 is a written examination that assess you on the basic and clinical sciences. This is almost similar to the part 1 examination of the ICO as well as FRCS. And then you appear for the refraction certificate examination, and following that you appear for the part 2 written and part 2 oral examination. Recently there has been some change in the way you can approach these examination, that you can also appear for part 2 written examination now after part 1 examination, and then clear the refraction certificate and then appear for the final examination. Now there is no minimum ophthalmic training that is set here. So unlike the other examination, you can appear for the part 1 for the refraction examination even in your first year of your post graduation or your DNB course. But for the part 2 written examination, you should have at least 4 years of minimum of training in ophthalmology. Now, unlike the ICO and the FRCS examinations, there are no exemptions in FRC Since it is an exit exam, you cannot have exemptions in this examination system. Now, when to start, you should decide early. Again, I would also agree with my preceding speakers that residency would be a good time to start preparing for these examinations, because it will provide you a balance of the academic, clinical as well as personal life. And how to excel, the mantras remain the same for any exam, that you should know your syllabus, you should prepare well in advance, and you should plan at length and have a good clinical exposure. Now coming to part 1 fellowship examination, it is an online examination. It is proctored and it's a theoretical paper which assesses you on the basic and clinical sciences relevant to ophthalmology, which is similar to the ICO and the FRCS examination. But in addition to that, you have patient investigations also are also being asked in this examination. So when to appear, there is no minimum training that is required. You can appear in your first year also, but since you need to know about the patient investigations and clinical sciences, it would be better if you appear in the final year or just after your residency. Now the syllabus and the resources, you can visit the website for the syllabus and the resources. Important here, I have already mentioned that the patient investigations are, you should be thorough with your patient investigations. Therefore, it's better to give the examination in the final year or later. Now coming to the refraction certificate, it's a practical exam in which you have 10 OSCE stations, and these OSCE stations will assess your practical skills on how do you perform retinoscopy. So you'll have simulators on which you'll have to perform retinoscopy, and you'll have patients as well on which you'll have to perform non-cycloplegic retinoscopy, and then subjective refraction, including refinement of cylinder and refinement of sphere, followed by binocular balancing as well as lens neutralization and photometry. So again, there is no minimum training requirement. You can appear in the first year as well, but you need to have an extensive practice before you appear for this exam. Otherwise, you will definitely not pass it. So again, the third year of residency, because you need to pass the first exam for appearing for the refraction certificate. So ideally, you should appear for this exam in your third year or maybe just after the residency. Now the resources, this important book which is on refraction and retinoscopy by Park, it is an excellent book and it is also recommended by the college. You can go through this book, but only reading will not help. You'll have to practice, because you'll be marked on certain other parameters also, such as how is your hand hygiene during the examination, how good was your rapport with the patient, and how well did you communicate with the patient, and how did you manage your time. So time management, even if you overshoot your time by few seconds and you're not given your answer, you'll be marked 0 out of the maximum marks. Coming to the part 2 fellowship written examination, it's again an online proctored examination, and it's a theoretical examination. Unlike the first paper, which assessed you only on the basic and the clinical sciences, here the entire curriculum will be, you need to be thorough with the entire curriculum. So when should you appear? You should have cleared the part 1 examination, and minimum 4 years of training is required for appearing for this examination. And so I think a fellowship or a senior residency would be a good time to give this examination. Now the syllabus more or so will be similar to your post graduation, but in addition to that, you will be asked about the health promotion, disease prevention, and continuing professional and personal development domains as well. Now part 2 fellowship oral examination, it is slightly similar to the FRCS part 2 examination, oral examination. It has the structured viva and the OSCE stations. Now again, you need to have 4 years of training to appear for this examination, and you should ideally, then the best time would be fellowship or senior residency to appear for this. Now in the structured viva, other than the patient management and patient investigation, you will also be assessed on how good you are in these domains such as the attitude, ethics and responsibilities, audit, research, evidence-based practice, health promotion, disease prevention. Now these domains are included because the Royal College relies heavily on what you should provide is a quality and safe patient care, and other than the clinical knowledge you should also be aware of these domains. Now in the OSCE you have a combination of patient examination as well as some video based examination in which you will be shown some videos and the examiners will examine you. And in the neuro-ophthalmology station, however, you have all three all three stations are all three patients are real patients. There are no videos in it. And unlike your FRCS examination, you may be even asked about the general neurological examination of the patients in those stations. So, for example, I was asked about examining the patient, performing a general neurological examination of a hemiparesis patient. So I started with the cranial nerves. I thought I'll stop till the cranial nerves which are involving the eye or the adnexal area. But then after that, they asked me to do the motor examination as a sensory examination also. But luckily, the bell saved me. And then you have the communication skill station in which there will be one patient who'll be a simulator. He or she will be a trained actor, and then you'll have to counsel those patients. Mostly you will be given a situation in which something would have went wrong and maybe in the surgery, and then you will have to counsel the patient. And believe me, they are very trained, and they'll get to on your nerves if you are not prepared. Now, what are the tips for clearing the part 2 oral and theoretical examination? You prepare your content list, what all you need to study. 3 months is more than enough time to prepare for this examination. Go to the clinical textbooks. Kansky and Oxford Handbook are enough for the clinical part. But for the non-clinical parts, as in the audit and ethics and the communication skills, you need to refer to the Oxford Manual of Training in Ophthalmology. It's a wonderful book. It will cover all those aspects. Then you should be thorough with the RCOF guidelines and the GMC good practice guidelines, because direct MCQs and direct OSCE questions will come from these guidelines as well. Now you should again be thorough with your ophthalmic investigations. Now there is not much resource which is available, unlike with FRCS. You have multiple books which are available. For the MCQ examination in FRCOF, you have a single book by Dr. Taryn Ting and David Steele. You can refer to that. And for Viva and OSCE, you have a book by Timothy Fung and Winfried that you can refer to. Now, most importantly, because you'll be assessed on how your rapport and communication with patient is, you should practice, you should improve your patient interaction also. Now, the pass criteria, as Dr. Devendra has already told, they are pass marks set in advance and they are not easy to understand. And the recent pass rates, they can vary anywhere between 35 to 80%. Now, this is worrisome that in Delhi, the refraction examination had just started a couple of years back, and the pass percentage was as low as 39% for the refraction examination. Now, validity, once you have cleared one part, that remains valid for 7 years. So you can appear for the next examination within that period. And you have certain 4 to 6 attempts also that you can give. Now, it's a long roadway. If you think that you'll finish these examinations in a couple of years, that may be a mistake, because I started giving them in 2018 and I finished giving the last exam in 2022 because of reasons that first, there are multiple steps, prolonged interval between the examinations, limited centers, and even if there are centers in India, you'll not get the diets every time. And if you see the exam schedule that is for 2024, there is no center in India which is going to conduct any of these examinations in 2024 now. So you'll have to wait for the next year for the examination center to come, and then you'll apply, and whether or not you get the diet is again a question. Now, the fees of FRCOF is exuberant. It is more than the FICO FRCS examinations. So in 2022, when I'd given my final examination, it costed me 2 lakh rupees. And in 23, the price increased by 200 sterling pound, and in 24 again by 200 sterling pound. So now it will cost you 2.5 lakh rupees for just the final examination. Now there is an annual subscription fee also. Once you clear the examination, there is an annual subscription that you have to pay to retain the membership. That is around 28,000 rupees currently. Now the mantras for clearing any examination remain almost the same. But important here is that you should practice clinical interaction, because that is very different in this examination from all other examinations. An ideal time would best time would be your just after the residency, or maybe in the final year of the residency you can start and then finish your rest of the examination during your fellowship or senior residency. And as my preceding speaker also mentioned, that keep learning and educating yourself, because there is no wrong time to give these examinations. Even if you are in your middle age, then also you can give. If you have you're in your clinical practice, then also if you're thinking about giving them, you can give, because successful people never stop learning. Thank you.
Dev- Thanks, Devesh. I think that really covered that topic, and it's definitely going to be of interest to anybody who wishes to emigrate. Our next speaker is Dr. Partho Pratim Datta Majumdar. Dr. Partho is, of course, a senior consultant in the uveitis department in Shankar Netralaya. But another important aspect to his personality is that he is the founder and operator of the e-Ophtha online resource, and he has extensive experience and knowledge about this topic, resource options for training in ophthalmology.
Thanks, Devendra, for having me here. For having me here. So I'll be talking on resource options in training in ophthalmology. I think Devesh has made my job very easier, because he has discussed all the exam-related textbook and the other resources. So I'll be talking, concentrating only on resource options which are available online. Just a disclaimer, I run this website for a long time, so I won't be discussing about this. So let's start. So when we think about online resources, I feel it is always better to learn from the best. So if you want to learn about a topic, particular topic or particular clinical entity, I always feel you should go to PubMed, search for the systemic reviews, meta-analysis and all. Cochrane reviews are also there. So you can, many of those articles are free for download, and you can download and read them properly. So that is very important. And the second thing is that AIOS has a system of registering into the one network. I think for last 3 or 4 months it's not working properly. So this one network is a very useful tool where you can access a lot of journals here. The online journals, you get the all articles to download, and you can see here there is an entire series of renowned journals available under this network. And there is a very interesting questionnaire sessions also, like MCQ type questions are there. So you can test your knowledge, and depending on your subspecialty, you can take these exams. And you can see here, this is a section of the uveitis which has 134 questions, and each questions there is an answer, and you will get a proper explanation of those answers. Now, another important part of this one network and this section is that they have a preferred practice guideline. So where there are various entities, they have they're like dry eye, that refractive surgeries, esotropia. So there are various topics they have covered in this preferred practice pattern. So another important is there is some case discussion. So a single case they have discussed in details. The various renowned people from the respective field, they discuss and analyze those case reports. So very good for us, and I feel it is a very must for the postgraduates and all the ophthalmologists. Then there is another popular website called Success in Emercy of, I think very old website, and very good collection of various basic eye examination. There are also information about Emercy of and ophthalmic trials, trivias, guidelines. So you must visit this website. Then coming to that, there's University of Iowa has several websites, and this is one of my favorite. This website is based on the gonioscopy mainly. So you can see a lot of videos, a lot of tutorials, and a lot of tips and tricks to decode various cases. So this is again the gonioscopy.org. So you can go and visit this website. This is another website by Professor Edward Stone. So he has created this website. This is very unique. Again, Iowa University initiative. So you can go there and see their atlas. They have the simulator where they present a case and you have to diagnose them. So most of this atlas, they deal with this hereditary heredomacular degenerations, and you can actually learn about the genetic inheritance of this disease as well. Now, this is another highly recommended website by CyberSite, and I think this is my best, means my favorite recommendation here. You can see here there are structured courses. For example, you see here there is a 12-hour online course on MICS, and you look at that, there are module systems. So each module, after module, you have to give an online exam. And for example, if you see here, the module 1 deals with the evaluation of adult cataract and preoperative assessment. So similarly, they have divided into various interactive sessions also. There are a lot of video-based presentation, and you can learn a lot from those. For example, this is about that module 1, that about the adult cataract and preoperative assessment, and you can see how the course has been structured here. This is again that basic history taking and evaluation of adult cataract. You can see here how they have structured it. First, the outpatient appointment, history taking, ophthalmic evaluation, and you see here how they have discussed these cases like a difficult possible scenarios, and what are the action to be taken for those conditions. So CyberSite is a very useful website for online resources. Now, this is, I think, one thing is getting popular in our world, like they call it traffic university. I think Ravin Sharma was the first to popularize it. You have a long time to commute to your workplace, or you are going to a place, so you can listen to certain audio clippings. They call it popularly podcast and all. So this is getting very popular in ophthalmology also. So here you can get one that's straight from the cutter's mouth. So there are several sections which are very interestingly designed so that you can learn while driving, or even simple, if you are going for a walk, you can actually listen to them. So this is another Eyes for Ears. This is another, you can see here that there are several topics they have discussed. For example, one interesting I have listened to is that pigment dispersion syndrome. It gives you a complete overview in a audio-based presentation. There are a lot of resources to learn about the OCT. This is one, OCT cases. This deals with most of this content of this website is free, so you can go and check. This is one, the recently designed the website, the iCare PD. So these are very good. These are they have several several courses rather. So you can see here they have designed one called Interpret. So what is that? That is because this is a interactive learning courses, and they give you several case scenarios and help you to understand the pathologies, and help you to decode all the diagnosis also. So there is one section called 1 minute OCT overview course where they will show you a case and you have to decode it. Then there is a iCare PD Pro, which costs around 11,000 rupees. So that gives you overall OCT diagnosis. And there is another section called macular OCT interpretation, which is available for 3,000 rupees, and that gives you an overview of the only macula centric OCT. Now, there is also a popular website, the iLearn, which deals with mainly the postgraduate exams and postgraduate question paper of various universities. And this is very highly recommended by the Moran Core. This is very interestingly done. You can see that several sections here. Each section has grand rounds, the resident lecture, the surgery videos, and various other options for the students and residents. Then there is a iFocus Online. All of you are aware of that. There is a YouTube popular channel, so you can actually listen to all these videos. Several specialties lectures have been added there. And this is a dedicated website by the Professor Andrew Lee. It's a neuro-ophthalmology. So there are several interesting videos you can go through, and he has explained it in very simple way. And I won't recommend you for the ChatGPT, because as you know, the main problem with the ChatGPT, as in a Lancet editorial, they said that there are a lot of they called it illusion. Means that ChatGPT can actually generate some artificial references and can cite from sources where you don't know. So if you are blindly following whatever the ChatGPT is generating, you will be in trouble, because sometimes if you ask them for some references, they will cite something which are not available in the literature. So this is another, I feel this is the answer to ChatGPT. This is called Perplexity. So Perplexity is similar to ChatGPT. The free version is also available, and the paid version is available. The main interesting point of this is, for example, I have just asked them that what are the differences between valsacloprid and valganciclovir. So they have given me the answer, but if you see here, there is reference here, and you can see that they have quoted the references, and this includes that 2 quotation from the PubMed also. So sometimes if you want to know certain things like some intravitreal dose or something like you need the exact figure for, so you can use this Perplexity, and that will give you the reference also, and you go to that reference and cross check your whether it's true or not. Thank you for your patience here.
Wonderful, Partho. I think you've covered past, present, and future of online resources in ophthalmology. Our concluding speaker, following which we'll have a discussion, is Dr. Rashmin Gandhi. Dr. Gandhi was with Shankar Netralaya for many years as a senior ophthalmologist and neuro-ophthalmologist, and then subsequently he has branched out into different vistas which are both ophthalmic related and some of which are not ophthalmic related. And I think it's very valuable to learn something from him, because we are often very myopic in our view, especially at the postgraduate level. So let's see what else can await us beyond our post-graduation and beyond into our careers. Over to you, sir.
Thank you. Thank you so much, Devendra, and thank you for this very kind invite. I have divided actually my talk as to when you are at the cusp of finishing your residency, or when you have just finished the residency. You actually go out of a set pattern that we have followed right from the school. You know that after 5th standard, you'll be on the 6th standard, 7th standard. You know, after you finish your MBBS, you're supposed to take a NEET exam, go to post-graduation, you finish your MS. As soon as you finish MS, the life is open all around, because there is no clear pathway, and that's what causes confusion in most of us as to what should we do. Should we just go ahead and do some fellowship? If we want to do fellowship, what fellowship would be right for me? Should I just join a trust hospital? Should I join a corporate hospital, academic institution, government institution, start private practice? Are there any other vistas where we can earn money? So these questions come up because the life is open 360 degrees. There is no one straight pathway that we need to follow. So keeping that in mind, I have divided this talks into 3 subsets. One is, what are the options in clinical ophthalmology after we finish residency, and what are the pros and cons of those options? Can we look at beyond clinical ophthalmology, staying within ophthalmology but not really practicing ophthalmology? And are there any options beyond ophthalmology or beyond medicine? So usual dilemma, as I said, is do we need to write any other exam, government institution, corporate hospital? So let's look at fellowships. I mean, the other confusion we always have is to what specialty would be right for me. And the most popular one obviously would be cataract refractive surgery or cornea refractive surgery, because the number of patients that you get to work on is simply higher. And obviously it also comes with a very obvious financial benefit. But the problem is that it can get monotonous after some years of practice. The intellectual challenge that you may encounter in your clinical practice would go down here, because it's machine driven and everything almost appears same after a point in time. So then why not we look at UVR neuro-ophthalmology, because so much of intellectual satisfaction. Each patient would be different, each patient would behave differently, would respond differently, would have a lot of diagnostic dilemma and whatnot. But the problem is, it is again mainly an institutional practice, and nowadays it is also driven by a lot of investigation. So while it can really give you a lot of intellectual satisfaction, but the commercial value of these subspecialty outside the institution is questionable. What about VR and medical retina? Another high flyer where you get to operate on different kind of patients. There is enough money probably available. Are there any problems there? And I don't know. The problem, of course. So that's what probably your. Okay, we'll stop that here. So obviously the point I wanted to make is that while there are a lot of options for treatment, at this juncture the patient's visual acuity or correction might still be a little suspect. So these are some of the options that one would think of in when we are do fellowships. A lot of us would know at the end of third year that this is what we want to do, but sometimes there can be a confusion. You would be liking glaucoma as well, retina as well, and cornea as well, and obviously you can't do all together. A good way where you can find out as to what you really want to do is take a break of a year and just do general ophthalmology. When you start managing your patients yourself, when you're not seeing masters at work but you're managing yourselves, is where you may realize sometimes that this is something which I'm good at and I'm liking it. And what about these options? After post-graduation, should I do private practice, medical college institutions, corporate hospitals? There is no clear answer, there is no correct answer. But if you're somebody who doesn't mind settling in a small city, money is a criteria, intellectual satisfaction not so much, then maybe a private practice would be a good idea for you. But if you really want to settle down in a metro, money is important, intellectual satisfaction not so much. Maybe a good corporate hospital might be a good fit for you. But you like teaching, you like research, you like to work on new things, then the fellowship or an academic environment would be a right pathway for you. What about passion? I mean, a lot of times when you go to some mentor, they'll always tell you, just follow your passion. But what is that passion? I mean, you can be passionate about multiple things. You would never know as to what is that passion that you need to follow. These are some of the tenets of what one can do with one's lives. Is that obviously you require money in some measure. What makes your life comfortable as per your definition, which can vary individually. A fame, obviously all of us want to be known in our peer group and also in the society as to who we are, what we stand for, and how we are transferring the skill that we acquire through our lives. Contribution to science, publications, you have the masters here who have really contributed to science with their original work, and contribution to society, you do high volume work or you help out people. So these are, I think, the basic tenets which might give you some satisfaction as you go for your work. But as I said, life 360 after post-graduation, where everything is open, you really require a lot of discipline. That's something which you need to have, saying that, okay, this is a pathway that looks good for me, and you're allowed to change at some point in time. But to follow that pathway, you require a discipline, because nobody is going to tell you that after first year you have to study this to be in the second year, because everything is open for you. And there are no excuses, of course, because everything is your decision now. It's a very exciting phase for us to be in India. I mean, in 90s, everybody was looking at the greener pastures in the Western world, UK, US, go settle down there, because we were constrained with the way we practiced medicine because of the resource constraint, the technology, the money. But all that is changing. In fact, and that's the reason why we are running this course, because a lot of people would like to write these exams and go and settle down somewhere else. But I think it's slowly changing. We have an access to the best technology. We are producing technology in India now, and maybe next decade we'll have our Indian machines, which probably will be more popular in all domains. So it's great to be in India. So are there anything else that we can do beyond clinical ophthalmology? Indian School of Business in Hyderabad, IIM Calcutta and IIM Ahmedabad, they have a specific MBA courses, 1 and 2 years. IIM Calcutta it's a resident course, while ISB it's a weekend course. I mean, it's a full-time course, but you need to be there only on a weekend. And you get the MBA from some of these very good institutions. where would it help you? You can become an administrator, you can be a CEO, you can run large organizations without really having to have an access to capital. There are eye care chains in India where the CEOs of medical superintendent are ophthalmology who have given up their clinical ophthalmology, are MBA, and are actually managing 70, 80, 90 hospitals across India. There is also a good opportunity to be an eye care entrepreneur. You can start your clinic. You may not be fully trained in all specialties, but now there is an access to a lot of money, the investor money. The people would be willing to invest in you if you can convince them about your passion and your direction, and you can start your own chain and have specialists work for you. There are a lot of these very interesting, not full-time, but a small-time project-based avenues which will give you a lot of money. You know, you can be a key resource person for somebody who's just doing a market survey. You can get a call and they'll take you around 1 hour of yours and they'll give you 15, 20,000 for that 1 hour, and they'll ask you relevant questions. They obviously would have to establish that you are qualified to answer those questions. The questions can be, you know, what IOL are popular and how do you use IOL or machine or whatnot. There are fintech companies like McKinsey, PwC. Now they have healthcare verticals and they employ doctors. And there the pay is really good because they pay you as what they would have paid in somebody in the US. So they are like really very good pay. But obviously you are completely away from clinical work. You're basically guiding them. You are bridging the gap. They know everything about the finance. They don't know much about the clinic, and you become the resource person to bridge that gap. Same with the tech companies. There are a lot of tech companies. Partho showed some beautiful websites. Obviously, some of these animations and videos are made by technologists, but they don't know, you know, which layer of brain, how is the pupil pathway activated. So they require that knowledge from you, and they nowadays pay quite well for that kind of resource. And what about something completely different? I have a friend of mine. He's not an ophthalmologist, but a doctor. He learned, and Partho mentioned about ChatGPT. So some of these generative AI now can generate code for you. You don't need to know the coding. If you know what your questions are, you don't even need a coder. I mean, within half an hour, you'll know or learn how to do a basic coding. So AI-driven solutions. So he has given up his MBBS. He started his AI company, and now that company is valued at 100 crores. So basically, you have now options to start something which is related to ophthalmology or related to preventive health, which can get you a lot of money. So in other words, it's very exciting era to be in. The technology is helping us to really chase our dreams. But obviously, we need to be very clear as to what really excites us and what probably would justify our existence, our brief existence on this planet. Thank you, Devendra.
Wonderful. I think so. The final talk in this session was something that was meant to open the discussion, and you know, we are happy to now take any questions on any of the particular talks or any aspects of the talks that we feel we may not have touched upon. We invite participation from the audience.
So let me ask our Royal College experts as to, if you have to choose to write one exam, Royal College exam, because that's a question that our students may have, which one would you choose? Would you choose FRCS Edinburgh, Glasgow, FRC of, then why?
Hello. Yes. So it will depend on what your future plan is. So if you want to settle abroad and you want to settle in UK, then FRC of would be the best option. And if you want brand recognition only in India and you want to do your clinical practice, then ICO is good enough. That will give you an option of a future fellowship abroad also. And if you want a brand recognition abroad as well, then I think FRCS is the best option. So it will totally depend on what is your future plan.
Yes, I think I agree with you, Devesh. The problem is that, you know, at this stage in one's career, everything is in flux, because not only is your training, your next step that you're going to take uncertain, your family life and personal life is also in a very dynamic state. Family commitments and, you know, pressures are also different. The financial pressures are different. So The advantage, at least it used to be 10 years ago, was the ICO FRCS pathway gave you a little flexibility because of cross exemption. You could avail of an ICO fellowship. You could also do the FRCS examinations. And if you are really keen to emigrate to the UK especially, then the FRCO of the examination is useful. But I think the clarity of thought now needs to come at an earlier stage as to what one really wants to do, because as we mentioned, costs build up. The time frame is not very short. It's over a period of 4 to 5 years that one has to sow the seeds for right now. So these are things that one has to really give a good hard thought to.
Partho, the question for you is that would you recommend, now you've talked about all the resources, so would you recommend preparing a particular topic only using these online resources, or do you think that the textbook has some role to play?
I think we have to be very careful while preparing any topic and all. ChatGPT or any artificial intelligence should be used for those. I think always I give a disclaimer that it's always better to learn from the PubMed. Means evidence-based literature should be the first option to learn from. And the ChatGPT is you have to, if you want to do some, like you want to search something which is you are not getting. For example, I'll tell you that something about Foscarnet in viral retinitis, you want to know that and you are not getting sufficient research, then this kind of perplexity you can search and it can give you that, is there any animal model study? So similarly, some organism you want to know about that and you are not getting it, so then you can take help of those online resources.
No, so that one point is taken. Now let's say you have an access to a very authentic website like Nodal, like Enrolli is one of the best teachers that we have. So now would you say that, let's say he is covering about NMO or MOG, related optic neuritis, would you say that watching that video is good enough, or you still need to dig your into the books and all that?
I'll give my personal opinion. So I feel it is always better to read the literature because you come across so many other things, and sometimes when you are like exhausted, you don't want to, then you can watch those videos or podcast I told you. So this can be a supplement resources, not
Absolutely.
a primary resource.
Not a primary resource, because it is one way and it's that limited what he has covered, while textbook allows you to dwell on the topic.
Correct,
and look
correct.
at the cross references.
And I always feel that the physical textbook is the best. I know many of you are familiar with the PDF version of the textbook and other. Yeah, and while searching for the textbook, at least some extra thing you may come across. And if you search electronic media, it will directly take you to that topic. So I feel always it's better.
Sir, and you had shown a lot of websites that are giving these training modules and
Yeah.
talking about these. So what is the bad side of it? These may not be regulated, or maybe those which are
Yeah,
started by
most of the online stuffs are not regulated.
So, but those which are from the universities per se,
Yeah,
you can rely on that. But
yeah, but
others-
that one network by American Ophthalmology, I was taking that UVA and I realized two places they have, that answer was wrong. So I wrote to them and they acknowledged their mistake, and I found that they have changed it, but it can be there. So you have to be very careful when you are dealing with this kind of resource.
Okay, so if there are no further questions, we'll conclude the session, I think 2 minutes ahead of time. Oh, there is a question. Please go ahead, ma'am.
Sir, what is the cost of servers showing the online website and the tutorials? Is it costing anything or something?
No, there are certain courses like OCD course I showed, you want to go for, there is a free version also, but paid version you have to pay for. It's an online structured course. At the end of it, you will get a certificate. It's a free.
So it depends on the website, depends on the resource. Within that same website, some courses may be totally free, some may be you may pay for. So it depends on how it is monetized. Thank you. Okay, thank you everyone and the AIOS for this opportunity. We hand over the session to the subsequent speakers and panelists. Thank you so much.